All right, welcome to RN Mentor free review for nursing review. And in this video, we will be talking about the causes of your vitamin B12 deficiency. So our topic for is under medical surgical nursing and under hematology. Okay, so let's talk about your causes of vitamin B12 deficiency. First, let's talk about your vitamin B12. Okay, when you say vitamin B12, right? The main source of your B12 in the body is from the diet, right? So it is the main source of vitamin B12. So that's right there. Next, all right. Now remember that not all food contains vitamin B12. Okay, not all foods. Only meat. All right. Only meat products has vitamin B12 in it. All right. Next, all right. Now, as a person eats food rich in vitamin B12, okay, as the vitamin B12 reaches the stomach, okay, it binds with a component called intrinsic factor. All right, this is your intrinsic factor, right? So I repeat, as the vitamin B12 reaches the stomach, it binds with your intrinsic factor. So ano po yung intrinsic factor? Intrinsic factor is the component that will enable the absorption, right? It will enable the absorption of vitamin B12. So kung walang intrinsic factor, you will not be able to absorb vitamin B12, all right? And your intrinsic factor is produced and oh, I replace the IF. Its factor is secreted by what you call your parietal cells. So remember, yung lining ng stomach are called parietal cells. So ito po yung nagsisecrete at nagwagawa ng inyong intrinsic factor na kailangan para ma-absorb ang vitamin B12. Alright, no? Next. Next structure na importante malaman is your ileum. Why? Because ileum is the site of your vitamin B12 absorption. Okay? I repeat, ileum is the site of vitamin B12 absorption. So, based on this information, we can therefore identify who are at risk or what are the possible causes of vitamin B12 deficiency. Right? Number one, since vitamin B12 is contained only in meat products, we can say therefore that one reason why a client will have vitamin B12 deficiency is because she is a vegetarian. Okay? So yung mga vegetarian po ay at risk of having vitamin B12 deficiency. Next, alright? So, pwedeng ang patient mataas ang diet niya for B12. Pero, kung wala kang intrinsic factor, you will not be able to absorb it. So, if wala kang intrinsic factor, hindi mo ma-absorb, wala ka ring vitamin B12. So, another reason for vitamin B12 deficiency is lack of the intrinsic factor. Now, what are the conditions that can lead to lack of intrinsic factor? First, of course, yung mga elderly, yung mga matatanda. Why? Because ang mga matatanda, nag-atrophy na po yung kanilang parietal cells. So, pag nag-atrophy yung parietal cells nila, wala na sila intrinsic factor. Another patient na walang intrinsic factor is yung mga patient na nag-undergo ng gastrectomy. So, removal of the portion of your stomach. So, kapag tinanggalan natin ng portion yung stomach, mababawasan ng intrinsic factor sa katawan. Alright? And the third possible cause of intrinsic or vitamin B12 deficiency is any condition, ileal conditions. So remember, ileum is the site of vitamin B12 deficiency. So kung may problema ka sa ileum, possible na magkaroon ka ng vitamin B12 deficiency. So, what conditions or specific conditions that can reach or that can result to malabsorption of vitamin B12 in ileum? First is a patient has yung tinatawag po nating Crohn's disease. Okay? This is a disorder that affects the ileum. Okay? So, it will be, since the ileum is affected, magkakaroon ka ng, o possible ka magkaroon ng vitamin B12 deficiency. Another will be patient who has ileostomy. Alright? Clients who have ileostomy tends to secrete water through the stomach. So, possible po na magkaroon ng vitamin B12 deficiency. Kasi nga, hindi nagtatagal yung content sa ileum, lumalabas agad sa stomach. So that's another reason. And of course, the client who has undergone what you call your ileal resection. Okay? So if magkakaroon ng condition sa ileum, kailangan tanggalin yung ileum, another reason kung ba't ka magkaroon ng vitamin B12 deficiency. So, these are the possible causes or patients at risk for vitamin B12 deficiency. Okay? For more videos on nursing review, keep watching our videos here in our channel and in our you can find us also in our Facebook page and of course in our website. Thank you.